Hi folks, today I want to highlight a somewhat concerning relationship between pain and hypertension that gets overlooked sometimes. This connection affects millions of Americans, with over 100 million people suffering from chronic pain and nearly half of all adults dealing with high blood pressure. Many people are managing both conditions without realizing how deeply interconnected they are. So in the next few minutes, I want to break down exactly how pain triggers physiological responses that affect your blood pressure and which specific pain conditions have the strongest impact on your cardiovascular health. And most importantly, I know offer practical strategies to help manage both issues effectively. Now let's start with the basics. Now, when pain strikes, your body launches an immediate protection response. Here's what happens. Pain activates your sympathetic nervous system, which is your body's fight or flight response. When this response is triggered, it releases stress hormones such as adrenaline and cortisol into your bloodstream. These hormones cause your heart to beat faster and your blood vessels to narrow and constrict. Now, when blood vessels narrow while your heart pumps harder, the pressure inside them obviously rises, leading to, if this continues for a long time, it leads to hypertension. Now, the key difference to understand is between temporary and persistent effects. A brief pain episode like stabbing your toe, it causes a sharp spike in your blood pressure, but that typically quickly resolves. But when this pain becomes chronic, lasting weeks, months, or even sometimes years, this pressure system stays partially activated, potentially leading to sustained hypertension over time. Now let's examine some specific, pain conditions that have the strongest connection to blood pressure issues. The first of them is chronic back pain. Chronic back pain is the most prevalent pain condition in America. Now, when the muscles in your back are constantly tensed and inflamed, they maintain a prolonged stress response in your body. Studies show that people with persistent back pain have higher rates of hypertension compared to the general population. What makes back pain particularly problematic is its impact on mobility. When movement becomes limited, physical activity obviously decreases, removing one of our best natural defenses against high blood pressure. Many back pain sufferers also experience disrupted sleep, which further contributes to cardiovascular strain. Next, let's examine migraines and severe headache. These conditions involve dramatic changes in the brain's blood vessels. During an attack, blood vessels first constrict and then dilate, creating significant blood pressure fluctuations. What's particularly interesting and concerning is that even between attacks, people with chronic migraines show irregularities in their autonomic nervous system, which is a system controlling involuntary bodily processes, including blood pressure regulation. Then we have arthritis, particularly rheumatoid arthritis, which creates a double challenge. The inflammation that causes joint pain doesn't stay contained to your joints. It becomes systemic, affecting your blood vessels and promoting arterial stiffness and damage. The inflammatory proteins that cause your joints to hurt are often the same ones damaging the delicate lining of the blood vessels. Moreover, limiting movement due to pain can lead to cardiovascular decline, which further increases your risk of developing hypertension. Now we come to what I call the medication paradox, when the very treatments meant to help your pain may actually worsen your blood pressure. This creates a very challenging situation for millions of people. The most common culprits are NSAIDs, non-steroidal anti-inflammatory drugs, which include over-the-counter options like ibuprofen and naproxen, as well as prescription strength varieties. Now, these medications reduce inflammation and pain by blocking specific enzymes, but they also have an impact on kidney function and blood vessel tone. Studies show that regular NSAID use can raise systolic blood pressure by an average of 5 to 10 millimeters of mercury in some people. Now, this might not sound like much, but even a 5 millimeter mercury increase in blood pressure translates to a higher risk of heart attack or stroke over time. In fact, studies show that a 5 millimeter of mercury reduction in systolic blood pressure reduces the risk of developing cardiovascular events by 10%. Other pain medications have their own issues and considerations. Opioids can cause blood pressure fluctuations, while some muscle relaxants may interfere with blood pressure medications. Tylenol or acetaminophen or paracetamol, depending on where you're watching this video from, has some of the most minimal effects on blood pressure. However, bear in mind that excessive use of Tylenol has its own considerations when it comes to your liver as well. So this creates a vicious cycle. Your pain triggers a stress response that raises your blood pressure. You take medication to relieve the pain, but the medication itself further increases your blood pressure. Now, this higher blood pressure can worsen inflammation and potentially intensify the pain, leading to more medication use. And unfortunately, the cycle continues. Breaking this cycle requires smart strategies that address both pain and blood pressure simultaneously, which is exactly what we'll discuss next. Now, I'll be the first to admit that I am no pain management specialist, but I just want to highlight a few points that you and your doctor can consider as you contemplate on the best way forward. The first is non-medication pain management techniques, which can be very powerful tools. Physical therapy that focuses on gentle strengthening and proper body mechanics can help reduce pain without the side effects of medication. For many conditions, especially back pain, physical therapy has been shown to provide lasting relief while actually improving cardiovascular health. When it comes to exercise, choose low-impact activities that won't exacerbate pain but still provide cardiovascular benefits. Water therapy is exceptional for this. The buoyancy reduces the pressure on painful joints, while resistance improves circulation and lowers blood pressure. Even 10 minutes of gentle aquatic movement 3 times weekly can significantly improve pain levels and blood pressure readings. Now, diet also plays crucial roles in both conditions. The DASH diet, designed initially for hypertension, also helps reduce inflammation that drives many pain conditions. So the pro tip here is focus on eliminating foods known to cause inflammation and prioritize an anti-inflammatory diet. Now, I have videos that I'll link in the description to help you guide you. I have done videos on both what to avoid and what to take if you're trying to follow an anti-inflammatory diet. Now, heat therapy, particularly for muscle pain, improves local circulation and may help lower overall blood pressure. Now, talking about heat therapy, topical pain relievers are sometimes unfortunately overlooked. Depending on the type of pain, you may benefit from the use of things like lidocaine patches or even sometimes topical NSAIDs like Voltaren gel or diclofenac gel, which are readily available over the counter these days. Now, while they are still NSAIDs, when applied topically, only relatively small amounts may be absorbed into your systemic circulation to wreak as much havoc as when you compare it to taking an oral pill. Also, when it comes to migraines, beta blockers such as metoprolol might be beneficial. These medications are often prescribed to manage blood pressure, but they can also be effective in preventing migraines. This, I know, will present a valuable option for some individuals, effectively addressing 2 concerns at once. So be sure to discuss this possibility with your doctor. Now, for more information, I recommend visiting the American Heart Association's website for blood pressure resources and the American Chronic Pain Association for pain management guides. Both offer excellent patient education materials that can help you advocate for comprehensive care. I'll put links to both organizations in the descriptions. And I sincerely hope you found some value in this video. If you did, please give it a thumbs up, share it to somebody who may also find it beneficial. And as always, stay blessed, and I'll catch you on the next video. Thank you.